Look in the sky. It's a bird. It's a plane. It's a superbug. Many of you may be asking, what is a superbug? NBC News defines superbug as an antibiotic-resistant bacteria. I first heard of superbugs when my grandma developed MRSA as a patient in a hospital. MRSA, or MRSA, is an acronym for methicillin-resistant Staphylococcus aureus. After a little bit of research, I discovered that superbugs are present in many different common infections such as pneumonia, tuberculosis, and a colistin-resistant E. coli. The superbug phenomenon, however, is not something that is new. In fact, Health and Medicine Week reports that penicillin resistance was first recorded in the 1930s, just a couple of years after the discovery of penicillin itself. So is that it? These infections become resistant to our antibiotics and we're all doomed? Not exactly. It's a little more complicated than that. There are two main factors that have been looked at when talking about superbugs and the spreading of MRSA and other superbugs. We've all seen signs like these at our retail stores, restaurants, etc. And even signs like these at our nursing homes, hospitals, and other healthcare facilities. There's reasons behind these. Improper hand washing is thought to be a contributing factor in the spread of MRSA and other superbugs. In fact, hand washing is still the main focus when it comes to talking about germs and transmission of things such as even the common cold. As described in the article Zero Tolerance published in the UK, hospitals have implemented zero tolerance policies for employees who fail to wash their hands. Some policies have even been implemented as recently as 2013. Another factor that is being looked at is misdiagnosis. Health and Medicine reports that about 50% of antibiotic orders in healthcare settings may be inappropriate. Introducing an antibiotic to the body leads to building a resistance to the antibiotic. Taking certain antibiotics when they are not needed can create a problem later if the body builds a resistance to the antibiotic when it is truly needed. In these instances, that resistance is what feeds these superbugs. Stronger meds will be needed to combat these superbugs. Many of these medicines carry significant potential for side effects. The Mayo Clinic shows common antibiotics used for treatment of some of these superbugs. Vancomycin is commonly used to treat MRSA, and Zosyn is commonly used to treat colistin-resistant E. coli. Both of these medications are commonly given intravenously and carry potential for great side effects. The Mayo Clinic states that Zosyn may cause temporary blindness and vancomycin may cause kidney failure. People taking vancomycin will need close monitoring and routine lab work to help prevent these complications. Along with zero tolerance policies on improper hand washing, various hospitals have made changes for stricter guidelines to help in better bed-by-bed patient monitoring in an attempt to prevent misdiagnosing and prescribing inappropriate medications. Even a minor reduction of inappropriate medications for misdiagnosed illnesses will help reduce superbug transmissions significantly. Failure to control these superbugs can result in death for many. Statistics found on the Daily Beast are quite significant. An estimated 90,000 Americans contract MRSA annually. Of these 90,000, 20,000 of them will die from it. These statistics prove that MRSA kills more people annually than AIDS does. The Daily Beast reports that by the year 2050, a staggering 10 million people will be killed by antibiotic-resistant infections yearly. In conclusion, superbugs are a growing problem in our healthcare settings. More and more lives are being claimed by these superbugs. In this day and age, it is strange to think that hospitals and nursing homes have implemented strict hand-washing policies along with proper bed-by-bed patient monitoring guidelines recently. But around 20,000 Americans will die from MRSA this year alone. So next time you go visit a loved one at a hospital, nursing home, or any healthcare facility, see if you observe proper hand-washing techniques. Every hand washed and bed properly monitored can save lives.